There are two types of deafness, as we all know. One is a conductive deafness, the other is a neural deafness. When there is any problem with the ossicular integrity, or when there is any fluid accumulation in the middle ear, or when there is any damage to the tympanum, this would result in a conduction deafness. But if the problem is in the inner ear or in the vestibular or the cochlear nerve, which forms the auditory nerve. We all know the auditory nerve has two components. One is a vestibular nerve and the cochlear nerve. The vestibulo-cochlear nerve is also called as the auditory nerve or the acoustic nerve. So if there is any lesions of these nerves, then again hearing gets impaired, and this results in neural deafness. So what happens is, if there is any damage to the facial nerve, so we have codes for the suture repair. And you need to know that there is a ganglion called as a geniculate ganglion. Genu means a bent, a knee-like bent. So you need to know whether the repair is being done to the facial nerve, lateral to the geniculate ganglion or medial to the geniculate ganglion. Medial is more complicated because it is more towards the brain. Okay. So through this Eustachian tube, the middle ear communicates with the nasopharynx. You can see a kid actually, it complains of earache after a cold. So what happens is, whenever there is like tonsillitis or oropharyngeal infections or nasopharyngeal infections, that gets transmitted to the middle ear cavity, and that would result in an earache. So whenever a kid complains of an earache, then you can suspect that the patient has a minor cold or any other infections of the nasopharynx. Okay, so whenever we yawn, what happens is this remains open. So normally it keeps closed.